Hey guys, welcome back. Today we're actually going to do a really fun one. We're going to go through, and as you can see, I've got someone with me today, which is going to help me. He's a little bit more in the industry, or has been in this industry in the past. We're going to talk about health insurance and how that might be able to, how we might be able to help you with regards to figuring out the health insurance space, which is going to be really cool. So my friend Dean is here, which is going to be really cool. He's, like I said, he's been in the industry before. He'll do a bit of a spiel on himself first, and then we'll get into the nitty gritty of it. But Dean, we've known each other for how long now? It's been
Over 10 years.
Yeah, I was going to say over
It's
10 years.
a long time.
So yeah, we've known each other quite some time. So very thankful for Dean for coming on board. So Dean, why don't you give a bit of a intro on yourself, and we'll go from there.
Yeah, no worries. Thanks, Joel. I used to work for Isolate. I was with them for about just under 2 years. During that time, I was a healthcare consultant, so, helping people work through their insurance needs. I then moved into a team leader role where I was helping train a lot of the new guys. And I was also an SME, or a subject matter expert during that time as well. So, helping guys understand, or helping the new guys understand, all the intricacies of health insurance, how we compare, how we can help, all of that sort of stuff. So, yeah, a lot of experience in that field. So happy to be here, happy to help.
Perfect. And I myself don't have a lot of experience in health insurance, not really a passion of mine either. So that's why I brought Dean on board to help me out a little bit here. So it'll be really good to hear from him. So we'll get into it. And we'll go through the first question. And I guess the first question is pretty simple, really. Health insurance, do I need it? So, Dean, do we actually need it? Like, what is it all about? Tell us.
Great question. I mean, I guess this is where a lot of people start looking into health insurance. Do I actually need it? It is a pretty basic question, but once you start going down the rabbit hole, it gets quite big. So, strictly speaking, no. Nobody needs private health insurance. We have one of the best public health systems in the world, and that's been reaffirmed many, many times. So why would you want health insurance? Just because you don't need it doesn't necessarily mean that that it's not a good idea to have. And for many people, it's extremely beneficial in terms of helping them, manage their health problems, or even financially. It can also be, really great depending on your personal situations. So, I guess the main three ways that we look at it is, from the health side, from the financial side, and then also the peace of mind side of things as well. Some people just like having it, knowing it's there. So yeah, those are the three main reasons people would look at it. So I guess starting off with the health side of things, obviously, the great thing about living in Australia and having Medicare is there's nobody who's dying on the street unable to access healthcare. Every citizen and permanent resident gets access to world-class healthcare. Where private health insurance comes in and where it can be really good is for those non-emergency procedures. So things like hip and knee reconstructions and replacements, all of that sort of stuff. Your more elective surgeries is where it can really, really help. Because there are a lot of people that end up on 5-10 year waiting lists, especially for a major surgery like hip replacement. And while you're not going to die or have any permanent disfigurement in that time, you're still dealing with pain and all of that. So, it can really help. Can really help deal with that and skip all those waiting lists and go straight into the private system. I guess what people need to know is just because you have private health insurance doesn't mean you're not going to be out of pocket as well. So, if you do decide to get one of these surgeries done, it's really important to have a chat to your doctor and see what your out of pocket expenses, which I'll touch on a bit more later, what those are going to be.
Yep, awesome.
From the financial side of things, there's a lot of taxes involved with private health insurance, depending on how much you earn or how much your family earns, depending on your age and that sort of stuff, which again we'll touch on a bit later.
Yep.
And obviously, peace of mind is really important for a lot of people. Just not having that worry that things are going to go wrong, and if they do go wrong, you have access to that system straight away.
Yeah, awesome. Absolutely. I think you've hit the nail on the head there. Sounds really good.
Yeah.
So what then, like if we look at the nitty gritty of health insurance and we move into like hospital cover, extras cover, I mean, some people can get pretty confused with what they need and I guess what they're looking at specifically. So maybe we just have a bit of a conversation on that.
Yeah, great. So, as you said, there's two types of private health insurance, hospital and extras cover. So your hospital is going into a private hospital and getting the care that you need through there. So your surgeries and all of that sort of stuff. How that works is Medicare sets out a list of a whole bunch of items. And depending on what your inclusions are, will depend on the level of cover that you have. The great thing about private health insurance is even at a basic level, 90% of surgeries are already covered under a basic level. Things like knee reconstructions are covered under a basic level. Where you start to get more advanced or mid or high level of cover will be things like heart surgeries or hip and knee replacements as opposed to a recondition. So there's only actually about 12 categories that actually make the difference between a basic level of cover and a top level of cover. So for most people, a basic level of cover is acceptable, but obviously it depends on your personal circumstances.
Yeah.
Extras are exactly as they sound. They're extra services that can be added on top. So they'll be things like dental, optical, so if you need glasses or contact lenses, physio, chiro, psychological services. There's a whole range of stuff, allied health services that are covered under that. Now, the one piece of advice that I gave everyone I spoke to is you really need to work out whether extras is economically viable for you. When I say that, the reason I say that is a lot of people just have extras just in case. The problem with that is if you're just having it there and never using it, you're going to end up spending a lot more than what you're going to ever potentially get out of it because there are a lot of limits. How much you can get rebated back, but also yearly limits. So, for a basic policy, $500 on a yearly limit on dental is pretty common. So, if you just have it there just in case, quite often you're going to spend a lot more money than you're ever going to get back. So, also with those sorts of things is you got to remember that Medicare has things like your chronic disease health management plan. So that's for things like if you need medically necessary physio and that sort of stuff. Mental health plans as well. So if you, again, medically necessary reason for you to see a psychologist, there are rebates involved in that with Medicare as well. So, extras is one of those things that it's not worth it for everyone, but there are definitely people that it is worth it for.
Yeah, for sure. I think we'll touch on that a little bit more because I think that's an interesting topic as well. Because I know that, like you said, you can get stuff from Medicare, like you can get physio or psychology. You get like 5 sessions, is that right? Normally 5 sessions from a GP?
Correct. Like so with your chronic disease management plan, for things like your physio and chiro and all of that, you get 5 per year. Now that's not fully covered by Medicare. It is a dollar amount covered. I believe it's around $80 from memory. and with your psychological services, it's 6 initially, and then you can go in for another 4, and that's per year. So, you can do that each and every year if need be. So yeah, definitely, if you do need those services, it's definitely worth having a chat to your GP about and seeing what potentially you can get covered under Medicare.
Yeah, fair enough. And so then it sounds like extras, like I know I have extras cover because I see an osteo normally once a month based on my training and stuff like that. It works out really well for me because I save money. But it sounds like you don't really need extras for... Would you say that? Would you say that a lot of people don't need extras? Is that something that... Or is that...
I would say so. I mean, the most common things people use extras for is your dental checkups twice per year and glasses. They're the 2 most common things. Now, if you're a single, a basic extras cover is probably going to cost you around $40 a month, roughly speaking. Now, if you're spending $40 a month, that's almost $500 a year. Generally, for your glasses, you'll get about $150 to $200 back per year on that, and about $100 to $150 per checkup back as well. So when you do those numbers, you do end up spending a lot more than what you get back. Now, if you have other things, as you said, like the osteo, physio, chiro, some will even give remedial massage and that sort of stuff. If you're doing those services, then it can definitely be worth it. But if you're not doing it, the biggest recommendation I gave people is just drop it. Most of your basic services, so your basic dental, optical, physio, and chiro will have anywhere from no waiting periods to a 2-month waiting period. So even if you do need to start those things at a later stage, it's not very long that you have to wait before you can start getting those benefits back. So, and unless you know that you do need these on a regular basis, for most people, it just doesn't become worth it. Now, obviously, I want to stress that, everyone's personal circumstances will change, and this is just general advice. So, definitely have a look at your personal circumstances.
Yeah, for sure. Absolutely. No, very good. And so then if we're looking at the bigger picture, because I don't want to delve too much into the specifics of things and just keep everything as general as possible.
Yeah.
When you're looking at a health fund or anything like that, what are you looking for in particular if you're looking at different health funds?
Look, I mean, there's a lot of, if you see ads on TV, a lot of them will say, oh, this fund is not for profit, this fund is for profit, yada, yada, all that sort of stuff. The reality of it with private health insurance is it's a very extremely regulated market in Australia. What that means is the government actually regulates how many new members a fund can obtain per year to make sure they don't grow too big, to make sure that they have money to pay out if they need it. They're also backed by the government. So if a fund does go under for whatever reason, you're not going to be left without insurance. It is all backed by the government. So to be completely honest, some people are more comfortable with larger funds. Some people want a non-for-profit. If that's your personal preference, that's fine.
Yeah.
But to be completely honest, when I recommend to people, it's whatever's going to be cheapest that covers what you need. That for me is the main thing because, like I said, it's all backed by the government anyway. So not one fund is going to offer better than the other.
Okay. That's interesting. That's really cool, actually. Interesting to know because I didn't know that in particular.
Yeah, and a lot of people don't. I guess one other thing to touch on as well while we're speaking of this is what a fund will pay out is going to be exactly the same as what every other fund is going to pay out. So our private health insurance is set up as a co-pay system as opposed to a full private health system.
Yeah.
What that means is a private health insurer, Medicare will pay 75% of what's called the Medicare benefit schedule, which is essentially a price list of all of services.
Yeah.
The private health insurer pays the remaining 25%. And the out-of-pocket expenses will come down to if a doctor decides that they're worth more than what the Medicare benefit schedule allows. That's when you're going to have out-of-pocket expenses. But that Medicare benefit schedule, that 100%, will be covered by every fund, no matter who you go with.
Yeah, right. Okay. Interesting stuff. That's really cool. So then, if you're, like you touched on, you're really looking for the cheapest fund that will give you the benefits that you need, roughly. So then, how much are you roughly looking at when it comes to health insurance and health funds?
It depends on the level of cover that you want. Also, if you're tacking on extras and all of that sort of stuff. I mean, anywhere from about $100 a month for a very basic level of cover can go all the way up to $300 or $400 for your top level of cover, especially once you start adding on families, independence, and all of that sort of stuff. So, as a very broad range, $100 to $500 depending on your situation. But it really depends on your situation as to what you're going to end up paying.
Yeah, for sure. Okay, fair enough. And there is a particular circumstance when, and because I want to sort of relate it back to the financial side of things, there's this particular circumstance when you are earning a particular amount of money where you actually have to look at health insurance because you don't want to pay the Medicare levy surcharge. Is that correct?
Correct.
Yeah.
Yes. So, as a single, if you're earning more than $90,000, or as a couple or family, more than $180,000, you definitely want to look at getting, at the very least, a basic level of cover. So, how these essentially work is everybody pays the Medicare levy. So, 2% of your tax every year, everybody pays.
Yeah.
So, if you see that on your tax return, there's nothing you can do about it, unfortunately. The Medicare levy surcharge, it is essentially designed to be an offset to, for higher earning people, they contribute more to Medicare. Obviously, Medicare is very important, so we want to make sure that we can keep it around as long as possible. So essentially, if you don't have it, you're going to end up paying, I believe, once you hit the $90,000 mark, it's 1.25% of your income.
Yep.
So that works out to about, $925 roughly on that first scale. It does go up the more income that the more you earn. So once you hit $120,000, it goes to the next step, and I believe $180,000. It goes to the final steps. So, it can end up being very, very costly if you don't have private health insurance. Definitely recommend that if you are in those brackets, have a look at it, because it is definitely worth it in most circumstances to actually get a basic level of cover. You'll end up paying less in premiums than what you do in tax.
Yeah. Okay. That's good to know. Fair enough. And I guess we'll probably touch on one more question that I have. And what would be your number one tip if you were still working at Isolate, when you were talking to all those people and stuff like that? What would you recommend would be your number one tip for looking at health insurance? If you were looking at it right now and looking at your own health insurance per se, and you're doing your own research, what would be your number one tip for the general populace?
The first place I would start is a couple of different places. Number one, have a look and see if your company offers a corporate discount. A lot of companies will have deals with Bupa or Medicare or some of the larger funds where they offer, I believe it's up to a 12% discount, which can obviously make quite significant savings if you're a family who needs a decent level of cover. So that's definitely something I would recommend looking at. The next step would be have a look if your industry has any industry exclusive health funds. So some industries or some companies will have exclusive health funds. For example, defense has access to defense health. Teachers have 2 different health funds that they can go through, which are exclusive to them. And they generally offer extremely good value for money services.
Yeah.
So definitely have a look at those. Um, Comparison sites are really good as well. You know, I'm not just saying that because I worked for one, but comparison sites, being able to search, you know, 8 to 10 different health funds at once, and starting to get a bit of a general gist of what is worth it is fantastic as well. You know,
Yeah, it just gives you that automatic. I guess it just makes it a lot easier for people to shop around as well. Like you don't
yeah,
have to do all the hours of research when it sort of just pops out for you.
100%. And the great part about it is, you know, if you go onto the iSelect or Compare the Market website, you know, they make it fairly easy. You know, you fill out, I want cover for this, I want cover for that, yada, yada, and it spits out the best results based on price for you.
Yep.
Even in that, it can still get a little bit complicated once you start looking at, you know, especially the extra side of things when you start looking at, all right, this pays $36 for this service, but this pays 40, but my annual limit is, you know, 300 on this, but 200 on that. It can still get a little bit complicated on there. So having a chat to a consultant who can break that down in terms of what it actually means for you is fantastic as well, because obviously they live and breathe it. You know, for them to understand exactly, you know, the intricacies of private health, it's what they do.
Yeah, absolutely. And that's one of the biggest things I always recommend is that whenever you're looking at any different service or product, you always talk to your professional in that field. It's always the best thing to do.
100%, definitely. Take advantage of the people that, you know, that may have more knowledge in that field than you. I 100% recommend that all the time.
Yeah, perfect. That's cool. Awesome. All right, Dean. Well, that's all the questions I have. But do you have any last, I guess, words or anything for everybody?
No, I think we've covered, you know, at a very basic sense. I think we've covered a lot of the questions. Obviously, you know, if anyone does have any additional questions that they want to ask, feel free to send Joel a message and he can pass them on to me. Yeah, we can go from there.
Perfect. No, that sounds really good. All right. Well, that'll be it for today, guys. I'll let Dean go and we'll be pretty much all done for today. But just don't forget to subscribe and make sure you hit that notification bell. Obviously, we want to make sure that you can get the videos and get the notifications once we upload, and like the video as well, because that's always important for making sure that more people can see the videos and get value from what we're going through today. So we'll leave it there. Have a good day, guys. We'll see you soon.